Have you ever wondered why a drug works perfectly the first time, but after using it repeatedly, it suddenly stops working, even though the dose is same? Does this mean the drug has become weak or has our body changed? So the answer is tachyphylaxis. Tachyphylaxis comes from a Greek word. Tachy means rapid and phylaxis means protection or resistance. So tachyphylaxis literally means rapid resistance. Now what exactly it is? It's a rapid decrease in response to a drug that develop within very short time. Sometime after just one dose or within a few hours of repeated dose. Now, imagine a patient with using a nasal decongestant spray. The first spray opened the nose very well, but after repeated use over a short period, the same spray produces much less effect, even though the dose has not changed. So, this rapid loss of effect is called tachyphylaxis. One important exam point is tachyphylaxis develop very quickly, and the tolerance that develops slowly over days or week. That is a major difference between a tolerance and tachyphylaxis. Now, how does this happen? So, tachyphylaxis, there is not just one mechanism. Different drugs develop tachyphylaxis through different mechanisms. Number one, the depletion of mediator store. Look at this figure. Inside this nerve ending, chemical mediators like noradrenaline are stored in small vesicles. When a drug, such as ephedrine, is given, it does not directly stimulate the receptor. Instead, it forces the nerve endings to release these stored medicines. And these are plenty of mediators to release these stored mediators. Initially, there are plenty here, so the drug produces a strong effect. But if ephedrine is used repeatedly, this repeated use, what happens is these stored mediators become depleted. So you can again imagine the same thing, like imagine if you have a empty water tank. If you keep taking water out without refilling it, eventually no water will remain. So similarly, when mediator stores become empty, the drug has here nothing left to release. So even after giving another dose, there is no mediators available, which means no response. No mediator, no response. That's why the diagram ends with no mediator and no response. And a classic example of this kind of thing is ephedrine. Now, second, receptor downregulation. Normally, what happens is many receptors are present on the surface of cell. When the same drug keeps stimulating the cell for a long time, the cell tries to protect itself. How? It starts pulling some receptors inside through this endocytosis. So this process reduces the spinocytosis you are seeing here. So this is the endocytosis process where the cells started pulling the receptors inside. This process reduces the number of receptors present on the cell surface. Now think about it like if the fewer receptors are available, so fewer drug molecules can bind. And if less binding, then there will be a weaker drug response. So the drug appears less effective. Common example is beta 2 agonist, like salbutamol. Frequent overuse can reduce the receptor number and decrease the bronchodilation. Third one is, this is slightly different. Receptor desensitization. We also call it uncoupling. So the receptor are still present on the cell surface. You can see the receptor are there on the cell surface. Here is the drug. The receptor are present. They are not removed like in receptor downregulation, the one which we have learned before. Here what happens is the receptor stop functioning properly. Now, after a drug bind to these receptors, this is the drug and this is trying to bind to the receptor. It activates a G protein here, which carry the signal inside the cell. This G protein will carry the signal inside this whole cell. Now, but after repeated stimulation, this protein called GRK and arrestin, these two interfere this signaling pathway. And what happens is the receptor become disconnected or uncoupled from this G protein. Easier way to remember is receptor is present, but it has stopped communicating with the cell. So again, beta 2 agonists are the common example of this. Next one, exhaustion of second messenger. After a drug activate, a receptor, the signal is carried inside the cell by the second messenger. Who are the second messenger? This CGMP. Okay. So if stimulation continue repeatedly, these signaling pathway become exhausted and the enzyme involved becomes saturated or depleted. As a result, the signal cannot continue. So even though the receptor is activated here, the message failed to reach the inside of the cell, which leads to a reduced drug response. Classic example is organic nitrates, where the continuous use reduces the effectiveness of CGMP signaling pathway. That's why these nitrate-free intervals are recommended. Okay, so mechanism 3 was receptor down regulation, where the receptor was present, drug is getting binded, but the signal is not there. Here, in this repeated exhaustion of second messenger, what is happening here? The receptors, the signaling, mean the drug is coming, drug is binding, receptor is activated, but the message failed to reach inside the cell. The final one, physiological adaptation. This is completely different because it involved the whole body, not just only the receptor. So what happened is, suppose an antihypertensive drug. This is a classic example of it. So antihypertensive drug lower the blood pressure. Now the body senses that the blood pressure has fallen. So maintain this again, the blood pressure which is fallen as per the body. So to maintain this normal blood pressure, it actually activate natural compensatory mechanism to increase the heart rate or constrict the blood vessel. So these compensatory response oppose the action of the drug. We are giving the drug to reduce the blood pressure, but the body is trying to again compensate it. So what is happening? The drug gradually lost its effectiveness. And the common example, antihypertensive drug. Now, how to overcome these tachyphylaxis? The one is drug-free interval, most effective method where the drug is stopped temporarily so receptor recover. Mediator store refill, signaling pathway return to the normal. For example, nitrate patches. These are removed for several hours every day. Next is dose escalation. Sometimes the dose is increased to restore the response. However, this should not be done by ourselves. I mean, the patient himself should not do it. It should be done under the medical supervision only. Next, the drug rotation. Sometimes the doctors switch to another drug with a different mechanism of action. So this helps restore the therapeutic response. The last one is combination therapy. Two drugs acting by different mechanism may be used together. And if one drug develops tachyphylaxis, the second drug can still produce its therapeutic effect. So, tachyphylaxis means rapid loss of drug response. It develops within minute or hour, unlike tolerance, and which develops over days or weeks. Five important mechanism: depletion of mediator store, receptor downregulation, receptor desensitization, exhaustion of second messenger, and physiological adaptation. It can be managed by drug-free drug escalation, drug rotation, or combination therapy.